Pregnant women should be extremely cautious when reaching for over-the-counter medications, even those long considered safe. New research suggests that acetaminophen, the widely used pain reliever found in Tylenol and many other medications, may be far more dangerous to developing babies than previously thought. A recent study published in Nature Mental Health has found a troubling link between acetaminophen use during pregnancy and a significantly increased risk of attention deficit/hyperactivity disorder, ADHD, in children. Given that ADHD already affects millions of children in the US and diagnoses have been rising rapidly, these findings should serve as a stark warning to expectant mothers and healthcare providers alike. The study, which analyzed blood samples from 307 pregnant women, found that children born to mothers who had detectable acetaminophen levels in their blood were more than 3 times as likely to develop ADHD. The overall prevalence of ADHD among children whose mothers used the drug was 18%, compared to just 9% in children whose mothers did not. Even more alarming, the risk was especially pronounced among daughters. Girls whose mothers took acetaminophen during pregnancy were 6 times more likely to develop ADHD than those whose mothers avoided it. These findings suggest that the potential risks of this common medication could be far greater than previously acknowledged, yet millions of pregnant women continue to use it without a second thought. The widespread use of acetaminophen during pregnancy raises serious concerns. It is estimated that 40% to 60% of pregnant women take Tylenol at some point, often on the advice of doctors who have long considered it the safest option for pain relief. But the assumption that acetaminophen is harmless during pregnancy may be dangerously outdated. Co-author of the study, Dr. Sheila Satyanarayana, has emphasized that acetaminophen was approved decades ago, long before researchers had the ability to study its long-term effects on fetal brain development. It was never properly evaluated for its impact on a child's neurodevelopment, meaning its risks could have been overlooked for years. Given this new evidence, many experts believe that the FDA needs to reassess its stance on the safety of acetaminophen use during pregnancy. The conflicting results from past studies make the situation even more concerning. While some research, such as a large Swedish study, has failed to find a link between acetaminophen and ADHD, other studies, including those conducted in Norway, have reported a significant connection. The inconsistency in findings has allowed health agencies to avoid issuing firm warnings, but this new study, which relies on direct blood measurements rather than self-reported data, provides some of the strongest evidence yet of a potential danger. In 2015, the FDA stated that existing studies on the effects of Tylenol during pregnancy were too limited to make definitive recommendations. However, given these new findings, the agency's previous caution may no longer be sufficient. Pregnant women cannot afford to wait years for further research, while unknowingly putting their children at risk. The implications of these findings are profound. ADHD is a lifelong condition that can severely impact a child's ability to focus, control impulses, and succeed academically and socially. As diagnoses continue to rise, researchers and parents alike are searching for explanations, and this new study suggests that something as seemingly benign as a common pain reliever may be playing a role. If a widely used medication is contributing to the ADHD epidemic, then urgent action is needed to reassess its safety. Until more is known, expectant mothers should think twice before taking Tylenol and should consult their doctors about alternative methods for managing pain. The medical community must take these findings seriously. The idea that a drug as ubiquitous as acetaminophen could have lasting neurodevelopmental consequences should not be dismissed. Pregnant women deserve clear guidance and full transparency about the risks of the medications they take. The FDA and other health agencies need to reevaluate outdated safety standards, and doctors must take a more cautious approach when recommending pain relievers during pregnancy. In the meantime, the safest course of action for expectant mothers is to minimize medication use whenever possible and explore non-drug alternatives for managing discomfort. The potential cost of inaction is simply too high.